here to have quite an important chat today, aren't we?
Yeah, a serious one as well.
And it's about the Cancer Won't Wait campaign, because I'm sure it's no secret that since COVID hit, one of the biggest communities impacted has been the cancer community. Lack of funding, which we'll go into, lack of awareness and, priority shifting, people being scared to go in. There's loads of things that we feel could have been done better.
Absolutely.
But we do need money, because money is what makes the change, right? So shall we start off with a comment that our wonderful Prime Minister, Boris Johnson, made recently, the never mind cancer comment. I think what was said was, never mind life expectancy and cancer outcomes, what about wage increases? So how did you feel about that?
To be honest, Lauren, I thought I'd misheard it, and then I thought I'd misread it. And I read it again and realised he had made that comment. And I think the politest version I can say is I was extremely disappointed. But that wasn't the language I used at the time. I couldn't quite believe our Prime Minister had said that. And of course, he's absolutely wrong. Cancer is one of the biggest, most important issues that we need to tackle today. And COVID has hit us so hard, so hard, that we hear stories like you do every day, every week, about people waiting for treatment, having their treatment postponed or delayed because of COVID. And this is deeply frustrating. And imagine in the community, from what I've heard, people are furious and angry. Have you heard much?
Yeah, I think there was a collective swear word probably when frustration when we heard that comment, because we're all out here fighting for better outcomes for the cancer community and for things to pick back up as quickly as possible. COVID was always going to have an impact on us, wasn't it? But it's to what extent? I buried a 29-year-old girl yesterday from breast cancer.
Sorry.
So to hear our Prime Minister say, forget about life expectancy and outcomes, don't tell me to forget about my friends, people that are dying. A lot of it is preventable. It is. If we had the funding and if we had an eye on it, it just feels, for me, what I find really hard, the pill to swallow is, it's all right for you to say that because you have access to the best healthcare in the world because of your privilege. There are people out there, the majority of the cancer community, who don't, and they rely on our NHS to survive. So we need it to be funded as well as possible so that it's proactive, not reactive. And that's where we're all out. I think we're all a bit scared because I feel like, even for myself, I was diagnosed with breast cancer 5 years ago and I am 4 years clear, which is amazing. But if I did get diagnosed again, or God forbid anything should happen, I am terrified as to what that would look like for me now, because it wouldn't be the same level of care, I'm sure of it. Can we get into the campaign? I'd really love to hear all about what Cancer Won't Wait is.
Well, Cancer Won't Wait is really our demand to this government to put the resources into the NHS to improve cancer services and cancer survival for all of those people who need it today. We know there's not enough workforce, we know there's not enough kit to diagnose people quickly, and we know that cancer survival just isn't increasing quickly enough in this country. We lag behind many comparable countries for cancer outcomes. It's just not good enough. I don't think it's good enough. Do you?
No, I don't. I definitely don't think it is. For me, any one life is a life too many. There's so much advancements, as we know, with you guys at CR UK in terms of medical research and getting us the drugs and where we need to be. But we need it to be on the ground, the people that are dealing with the cancer community, the people that are saving lives. And if the money's not there to back them and to make sure that they have all of the support they need, as I said, to be proactive, not reactive, we know that's where we're going to get the best possible care.
Well, Lauren, we know that one of the biggest differences we can make is diagnosing people earlier. Early diagnosis is key to improving cancer survival for so many different types of cancer. So when we look at what's happened because of COVID, over 3 million people didn't go through screening, 37,000 people, fewer have had tests and treatments. That's a real worry. So we need the money into the system to ensure services recover. But when you look at workforce, 1 in 10 NHS key posts have been vacant as it relates to cancer services. And you can build as many hospitals as you like. We need the workforce, which takes a long time to plan and prepare for, to ensure that our people are getting the treatment they need quickly. And we also need the right kit. We're right at the bottom of the OECD league tables for really important kit like MRI, etc. In radiology, 33% shortage in workforce. I mean, so we're saying use the comprehensive spending review, which is that big time when they outline their big spending plans, to ensure that cancer gets the resources and money it needs to help people today.
What really upsets and like worries me, because I'm a very positive person, and I always go, right, now where there's a will, there's a way. There's only so far you can push that. And I just would hate the thought of anyone diagnosed with cancer that wouldn't survive because of a fall down, because of a lack of funding. Like, no one should not be here because the best wasn't done for them. Like, we're people, we're not hospital numbers, and that's like the work I do in the community, we're human. And not seeing us as stats, but actual human beings who want to live and want to live well.
Well, every person is loved, aren't they? They're part of a family, they have their friends, and you're absolutely right to say it's not about the big stats, it's about each and everybody's lives. And it's devastating what's been happening during COVID. We all know staff in the NHS have worked so hard. A third of people we surveyed had said their experience had gone down during the pandemic. We don't have to accept this. It doesn't have to be this way in the future. So get the right plan, the right people, the right money, and we should be able as a country, right? We should be able as a country to have some of the best cancer survival rates in the world here, not some of the worst.
Yeah, that makes total sense to me, that the capability, the possibility for that impact and to improve things is phenomenal. And it's not going to take that much to do. We just need the commitment, and not just the commitment to actually see the funds coming through, because we need it to happen sooner rather than later. We already know that there's a COVID backlog, so even being promised this funding, we need it in the NHS now, not in 5 to 10 years' time.
And you've talked a lot, haven't we, about this government saying what the UK is going to be like post-COVID, post-Brexit. As one of the things it should offer the people is a positive view about how we're going to tackle cancer, how we're going to improve cancer survival in this country. And 1 in 2 of us will get cancer in our lifetime. It affects us all. So this government needs to listen to cancer patients, cancer advocates, organisations like our own, because we're all clear, aren't we? We know what the plan needs to be.
And I do just feel like as well, like if you listen to us and we get there quicker, then it's one less person in your ear and one less thing on the to-do list. Like, just get it done. Let's save some lives. Like, why wouldn't that be the priority?
And do you find that lots of your friends who are active in the cancer community, do they feel they're being heard by this government?
No, they're not. They're not. I mean...
Or their local MPs even?
No. I think it's what we all do know is that our teams in the NHS, our teams at the hospital, are working relentlessly to do the best they can to keep us here and to keep us living well with and beyond the disease. Yeah. What they are struggling with is having the support of our government to do that job as well as they can do. No person who works in oncology in any facet of our medical healthcare system should be put to breaking point to do that. And they are. And it's really upsetting because, as I said, you know, my community want to go in and have the faith. There's no doubt in their mind that the people who are there aren't working as hard as they possibly could to get them where they need to be and to get them out of cancer and survived and living the rest of their life. But actually the falling down is systemic. And that.
And are you hearing lots, you know, a bit like our survey, a third of people reported a worse experience. Are you... Yeah, people talking to you about what that practically means? Well,
practically we know that more and more people, especially young people, are being diagnosed at stage 4. But we know that the stage 4 funding isn't there. We know that when people are living with the disease for a longer term, that we need access to drugs quicker. We need the workforce to be able to deal with their ever-changing needs, because as people live longer with the disease, the needs change, don't they? Because it's uncharted territory for a lot of the cancers that we're seeing life expectancy increasing for. But also we need that workforce to be able to understand the human. Every single cancer diagnosis is as unique as the human attached. It's a humanistic approach, not a mechanical one.
And every cancer is different for each person.
So individual. And we know that in terms of research, everything is moving into genetics, isn't it? But in terms of the cancer care on the ground, we need it to not necessarily be a blanket approach to everyone's care now, because needs are so individual. And I think where the workforce is so stretched, that they are having to do the bare minimum, and actually they should be able to do the maximum because they should be supported to do so. Yeah, and especially with the stage 4 community at the minute, it is crying out, like, as I said...
People are tired, aren't they? They're angry, anxious, devastated in many instances. But one of the things I think we're keen also to do is galvanise that and say, well, we can work together to change it. You know, this is this moment with the comprehensive spending review where if we can work together and have one voice, then we are really aiming to get those demands responded to and heard around better workforce, better funding for kit, and also the right services in place to ensure everyone gets personalised care.
Exactly that. And I think from what my feedback is from the community being so on the ground with them is I think we're done with talking and awareness now. It's like, where's the action? We don't want promises, we want action, because promises aren't saving lives actually. The actions are. So I think what you guys are doing with Cancer Won't Wait is so important. And we just would love to know, how do we get people involved?
Well, you can hashtag Cancer Won't Wait and get involved in that way. Sign our petition, which is before the UK Parliament at the moment, which is demanding extra investment in the NHS for cancer, and write to your MP. I know people are saying, oh, you know, do I have to go and talk to my MPs? But many of them do listen, and it's through this groundswell of support, that strong and united voice together, I think we can have the biggest chance to get some real change and some real action, which will make a difference to everybody.
So we need people to be talking about it with the hashtag Cancer Won't Wait. We need people to be signing a petition, and we need people to write to their MPs.
Perfect.
That seems like something you could do over a cup of tea to me.
Yeah. And we know that you said at the beginning, it's not about numbers, it's not about statistics. I think that's absolutely true, because one person's personal experience can have just such an impact and influence on politicians and ministers and governments, because you know it is in that one experience that tells the experience of many, and it won't be lost. I mean, I think we're stronger together.
Oh, well, without a doubt, we're stronger together. And, you know, from experience, I can tell you, the cancer community, they're not shy, and they will tell you exactly what they need if only they'd be heard. So thank you so much for doing this on our behalf. It is so important. We are all behind you with it. This is the change we want and we need. So let's make sure that we get this hashtag petition MP.
Thank you. Really appreciate it.
Love you.
Oh, cheers.